They called it research. In reality, it was a crime against humanity. Follow for more buried medical history they never taught us. In the 1940s, U.S. government doctors carried out secret experiments in Guatemala. Their mission? To study sexually transmitted diseases. But instead of using volunteers, they infected people without consent. Prisoners, soldiers, psychiatric patients, even children in orphanages were deliberately exposed to syphilis and gonorrhea. Some were injected with the diseases. Others were forced into encounters with sex workers who had been infected on purpose. The goal was to test antibiotics. The cost was human life. Hundreds were left untreated, their bodies ravaged while doctors observed the progression. Over 1,300 people were used. At least 83 died. Here's the kicker. This wasn't a rogue operation. It was backed by the U.S. Public Health Service, the very same agency that would later run the Tuskegee Syphilis Study on black men in Alabama. Different country, same betrayal. For decades, the Guatemala experiments stayed hidden, locked in files. It wasn't until the early 2000s that researchers stumbled across the records, and in 2010, over 60 years later, the U.S. finally issued an apology. By then, most victims were gone. Justice never came. So tell me, how can a government apologize for something this horrific without ever making it right? Do you think Guatemala should have demanded reparations? And if this could be hidden for half a century, what else is still buried? Follow Buried Medicine, share this story, and keep the truth alive.